I am Professor Dr. Shankar, Professor of Medical Genetics, Government Medical College, Trivandrum. The couple came for genetic counseling with the first child is having so many genetic disorders. Before the era of next generation sequencing and microarray, we will be able to have a definitive diagnosis in a very few conditions only. But after the introduction of next generation sequencing and microarray, most of the genetic disorders we were able to look into or identify at the gene level or the copy number variant level, and we can confirm the diagnosis. We can identify whether the parents are carriers, and we were able to look for the prenatal diagnosis in the next pregnancy and give a couple a definite answer regarding the recurrence risk and reproductive options. At the same time, this genetic level molecular targeted identification of defects will help to development of newer targeted therapy for the most of the or some of the genetic disorders. So, as rightly told, this test help in the better outcome and counseling of the patients. For example, I had a couple with two children affected with neurodegenerative disorders, but before that era, nobody was able to identify what was the problem. By the advent of next generation sequencing, we were able to identify or pinpoint is one of the rare leukodystrophies, and we were able to counsel them recurrence risk is 25%, and next pregnancy we have done the prenatal diagnosis and they are having a normal baby. Similarly, another family with two children affected with the microcephaly, consanguineous parents, where a definitive genetic testing has been identified to have a normal child in their successive pregnancy. So these tests and counseling has dramatically improved the outcome of the pregnancy. Similarly, the risk, tension and stress of the couple has been significantly reduced. Compared to conventional tests, these advanced tests are able to identify problems in a better way and outcomes are better, and with the reduction of the cost of these tests, most of the people will be able to avail this test and the reproductive outcome will be better in the future.